Dr. Picardi did an excellent job of understanding and explaining why this bill is going to ration health care to the elderly. And it's going to be based upon quality of life, based upon the number of years you potentially have long life to live. That's going to be divided, potentially they're going to be denied care. But no one's mentioned yet the cost of the unborn. The AP Time magazine has reported, in contradiction to President Obama, that abortion will be included in this bill. Numerous attempts by members of Congress in order to specifically exclude abortion have been beaten back. We know that much of the groundwork for this bill was laid in the first stimulus bill that no one had time to read, the 15-member commission that will determine what health care is effective, the cost of it. Senator, wouldn't it be better just to kill this bill and to start over again with a different Congress and different bills?
I think that the issue of the cost of health care and the impacts that people are having are real. And I think that we need to try in a meaningful way to address those. But no health care reform would be better than that health care reform. What I'm trying to do is advocate for the things that I mentioned earlier that will drive costs down, that will do something to give people in this country more access to health care. That isn't a government-run program. And a government-run program, as you mentioned, tells you what's covered and what's not covered. And we've had a policy in this country going back to the Reagan administration that the federal taxpayers those dollars that you pay as taxpayers don't go to cover abortions. That's been a policy that's been consistent now for the past 30 years. If we go to a government-run plan, or if the government tells private insurers what the standards are, what's covered and what's not covered, that will change. And they can say what they want, but the fact of the matter is there was an amendment offered in the Senate and there was an amendment offered in the House to both of those bills to reassert that policy that federal tax dollars will not go to cover abortions, and those amendments were defeated. So, you know, if that's an issue that's important to you, that's also an issue that's going to be very relevant in this debate. And I think we ought to fix health care without having the government run it and have the government making all those decisions and telling people at the end of life or before life, as they're in you know, prenatal state, that they're not going to be covered. I think that's, or that they're going to be, in this case, with the issue of abortion, that those are going to be covered by federal funds. That's just not something that in the past we've done, and I don't think it's something we ought to do in the future.